Question 1. During a routine prenatal appointment, the client asks the nurse what is the average heart rate of a baby during pregnancy. Which of the following fetal heart rates is within the normal range? C. 135 bpm. The average fetal heart rate is between 110 and 160 beats per minute, bpm. It can vary by 5 to 25 bpm. At full term, the rate is about 130 bpm. A rate of 110 bpm or less usually indicates fetal distress caused by hypoxia. A rate of over 170 bpm can have several causes: congenital heart conditions or defects, anemia, chromosomal conditions, or hypoxia. Question 2. The nurse is teaching parents to administer eardrops at home. Which action will indicate that the parents understand? C. Watches the parents administer the eardrops. Observing a return demonstration is an excellent way to assess a skill. The nurse can evaluate the actual administration of the drops and ensure that the steps are followed in the proper order. Question 3. A patient has been diagnosed with primary syphilis, stage I. When assessing the patient, which of these findings will the healthcare provider anticipate? A. Firm and painless genital ulcer. The first indication of the primary stage of syphilis is the appearance of a single chancre, although there may be multiple sores. A chancre is a round, firm, and painless sore found at the location where syphilis bacteria entered the body. Syphilis is caused by the bacterium Treponema pallidum. It typically follows a progression of stages, including a latent stage that can last for weeks, months, or even years. Syphilis is easily cured with antibiotics. Question 4. After the nurse does an assessment of an 83-year-old with dementia, what will be the most realistic plan of care for the client? B. The client can be supported to function at the highest possible level of autonomy. Every person should be encouraged to function at the highest possible level. Support and assistance will change over time, but well-being depends on having a sense of control. Instructing a client with dementia will not be effective. Moving the client to a facility is not a client-centered action. The family should be involved in planning for their loved one but not asked to provide extensive care. Question 5. While planning a prenatal nutrition class for primogravid clients, the nurse knows to discuss the need for adequate vitamin A intake. Which of the following foods should the clients choose for their diets? B. Egg yolks and squash. Egg yolks, squash, and yellow or orange vegetables such as sweet potatoes and carrots are good sources of vitamin A. Other excellent sources are fish oil, liver, whole milk, dark leafy greens, and dried apricots. However, pregnant clients should avoid excess vitamin A, because it can cause malformations in the fetus. Milk and cheese are sources of calcium. Berries, broccoli, oranges, and tomatoes are rich in vitamin C. To help you remember which foods have vitamin A, use the mnemonic I must feel very lively. I. Vitamin A helps with vision. Get it from eggs. Must, milk, whole. Feel, fruits. Very, vegetables in lively colors of orange, yellow, and green. Lively, liver. Question 6. The nurse prepares to administer a pneumococcal vaccine to a 65-year-old client who has a diagnosis of chronic bronchitis. The client states, "I got that vaccine 5 years ago." What is the most appropriate response by the nurse? C. Your last shot was when you were 60, so a repeat vaccination is recommended. To help prevent pneumonia and its complications, a one-time repeat pneumococcal vaccination is recommended for individuals who are less than 65 years old when they received their first vaccination. Some high-risk groups receive an initial pneumonia vaccine of PCV13, pneumococcal conjugate, before age 65. The CDC recommends a second vaccination of PCV23, pneumococcal polysaccharide, at age 65 for these patients. Clients who are 65 and older should receive both vaccines, 1 year apart. Question 7. The mother of a hospitalized 3-year-old tells the nurse that she must leave for a short while to pick up the child's sibling from school. The child asks the nurse when the mother will return. What is the nurse's best response? A. You will see your mom after you watch your favorite show. Preschoolers, ages 3 to 4, do not have a clear concept of time. They develop the concept by meaningful experiences, such as birthdays, and with their own schedule, such as meals or bedtime. They feel secure when they can understand and follow a schedule. They do well with before and after explanations. Question 8. A woman in the second trimester of pregnancy is diagnosed with preeclampsia. Which of the following statements about preeclampsia will guide the care provided to this patient? C. If untreated, preeclampsia may result in fetal growth restriction. Preeclampsia is a multisystem, vasospastic disease. A vasospastic disorder results in intermittent or impaired arterial circulation in the body. Vasospasm in the placenta causes impaired placental perfusion. Impaired perfusion results in decreased delivery of oxygen and nutrients from the placenta to the fetus, restricting fetal growth. Question 9. The nurse is caring for a 3-month-old infant with infectious gastroenteritis. The infant is lethargic, and the mucous membranes are dry. Which other finding would indicate moderate dehydration? B. Sunken fontanelle. A sunken fontanelle is a sign of increasing dehydration. It is first noticed when dehydration progresses from mild to moderate. Mild dehydration may be evidenced by increased thirst and decreased urine output. Anuria, no urine output, is a sign of severe dehydration. Question 10. The high school nurse is teaching a sophomore health class about sexually transmitted infections, STIs. Which of the following is the most common STI in the United States? A. Human papillomavirus. Human papillomavirus, HPV, may not show any symptoms until it causes genital warts, a bump or group of bumps in the genital area. About 80% of sexually active people will contract this STI at some point in their life. Cancers from HPV may not be evident until they are discovered through routine screening. Chlamydia is the most common reportable, or notifiable, STI in the United States. Both men and women can get chlamydia. While the disease is easily cured, it can severely and permanently damage a woman's reproductive system, making it difficult or impossible for her to become pregnant. Chlamydia infections often have no noticeable symptoms, so persons infected with chlamydia may be unaware that they are spreading the disease to others. Anyone who has unprotected sex can contract chlamydia, although statistics show that sexually active young people, particularly women, are at higher risk. Gonorrhea is the second most reportable STI, followed by syphilis. Question 11. What is the best way to educate a 10-year-old girl about her upcoming heart surgery? C. Use a model of the heart to show her how the surgery will go. According to Piaget, the school-age child is in the concrete operational stage of development, 6 to 12 years of age, which is the beginning of logical thinking. Using something concrete, such as a life-size model, will help the child better understand the explanation of the heart and NBSB surgery. Question 12. The human body changes with aging. All of the following changes occur as a person grows older except A. Taste bud sensitivity increases. Aging is a gradual, continuous process of natural change that begins in early adulthood. During early middle age, many bodily functions begin to gradually decline. Generally, when people are in their 50s, the ability to taste and smell starts to gradually diminish. Both senses are needed to enjoy the full range of flavors in food. And NBSB, bones tend to become less dense. Muscle mass and muscle strength tend to decrease beginning around age 30 and continuing throughout life. By age 75, the percentage of body fat typically doubles compared with what it was during young adulthood. The number of nerve endings in the skin decreases. As a result, people become less sensitive to pain, temperature, and pressure, and injuries may be more likely. The nose tends to lengthen and enlarge, and the tip tends to droop. Question 13. A 38-year-old female primigravida comes to the obstetric clinic for her first appointment. As the nurse takes the client's medical and health history, which statement by the client should the nurse follow up with first? A. I've been on lisinopril for 2 years. Lisinopril is an ACE inhibitor. ACE inhibitors, antihypertensives, are pregnancy category X, because they may have teratogenic effects on the developing fetus and increase the risk of birth defects. The nurse should notify the primary healthcare provider, HCP, of this pertinent information. Folic acid supplementation is recommended during pregnancy to aid in fetal neurological development. The family history of diabetes and tuberculosis is important to note, but it is not the priority for this appointment. Question 14. Because neonates are deficient in a substance that prevents bleeding, the American Academy of Pediatrics recommends that all newborns receive an injection of what supplement within a few hours of birth? B. Vitamin K. Since 1961, the American Academy of Pediatrics has recommended supplementing low levels of vitamin K in newborns with a single shot of vitamin K given at birth. And NBSB. Low levels of vitamin K can lead to dangerous bleeding in newborns and infants. And NBSB. The injection is usually given within 6 hours of birth. Erythromycin is instilled into the eyes to prevent damage from sexually transmitted infections. The first dose of hepatitis B vaccine, HBV, is recommended before leaving the hospital. RhoGAM is given to Rh-negative mothers to prevent Rh sensitization. Question 15. How long is the first phase of the transitional period of the newborn? C. 0 to 30 minutes. The first phase of transition, first period of reactivity, starts at the moment of birth and lasts about 30 minutes. During this phase, the neonate is typically alert and active. Vital signs may be unstable as its respiratory and circulatory systems are being established outside the womb. Question 16. The nurse is preparing a community presentation on how to recognize the signs and symptoms of a stroke. Which of the following should the nurse include? A. Sudden slurred speech. The nurse should present and explain the acronym FAST to the group. F equals facial drooping. Ask the person to smile to see if it's uneven or lopsided. A equals arm weakness. Ask the person to raise both arms to see if one drifts downward. S equals speech. Ask the person to repeat a simple sentence. T equals time to call 911. If the person shows any of these symptoms, even if they seem to go away, get the person to a hospital immediately. Additional signs of a stroke are sudden numbness, sudden confusion, sudden vision problems, sudden trouble walking, or a sudden headache. The other answer options are not related to recognizing a stroke. Question 17. When a child is able to grasp the idea that a ball continues to exist even after the parent has placed the ball under a pillow, which of the Piaget stages is the child in? B. Sensoromotor. According to Piaget, during the sensoromotor stage, 12 to 18 months of age, a baby gains understanding about causality and object permanence. The baby learns that objects continue to exist even when they are placed out of sight. During the preoperational stage, 2 to 6 years of age, a child's perception is based on how they interpret an event. The concrete operational stage, 6 to 12 years of age, is the beginning of logical thinking. During the formal operational stage, 13 to 18 years of age, an adolescent is capable of abstract reasoning. Question 18. Which of the following alterations in sensory function is normal for an elderly client? B. Decreased chronic pain perception. As people age, the perception and reporting of chronic pain decreases after the 7th decade. Studies show that many elderly people believe that chronic pain is a natural part of aging, and they consider pain less serious than other life events, such as loss of a spouse or independence. Acute pain remains consistent across all age groups. In general, the aging process causes the sense of taste to diminish because of reduction in the number of taste buds and shrinkage of those that remain. The sense of smell also decreases, which compromises both smell and taste. Eyes become more sensitive to glare and harder to adapt to darkness. Hearing and balance are also affected because of changes in the auditory nerves. Question 19. The nurse is providing instructions for a client who has just given birth to her first child. The nurse explains about lochia and what to expect. Which statement by the client indicates a need for more education? C. Bright red bleeding can last from 2 to 4 weeks. Lochia is vaginal discharge after childbirth. It consists of blood, mucus, uterine tissue, and other materials from the uterus. The 3 stages of lochia are: 1. Lochia rubra, 3 to 4 days. Bright or dark red blood, often with small clots. Flow is heavy. The client can expect to change a thick maxipad Q3 to 4 hours, mild cramping can occur. 2. Lochia serosa, 4 to 12 days. Pinkish brown, watery, with few or no clots. Flow is moderate, a regular pad is sufficient. 3. Lochia alba, 12 days 6 weeks. White or yellowish discharge, little or no blood. Light flow or spotting, a panty liner may be sufficient. Question 20. The home health nurse observes that the client's spouse is suffering from the strain of caregiving. How should the nurse assess the spouse to determine if there is a need for further assistance? A. Ask the spouse about their support systems. The nurse should first assess whether the spouse has any support systems. Without other people or services to rely on, the spouse can develop caregiver burnout, a state of physical, emotional, and mental exhaustion. Relaxation activities are impossible without a respite service for the spouse. Asking about the client is inappropriate. Question 21. A 69-year-old female has just been diagnosed with osteoporosis. Which instruction by the nurse is most appropriate for the client? C. Start weight-bearing exercises. Osteoporosis is a major cause of disability in older women. Weight-bearing and strength training exercises are and NBSB best for treating osteoporosis. Although loss of bone cannot be substantially reversed, further loss can be greatly reduced with safe exercise. Placing weight on bones against gravity helps promote ossification. Running is a high-impact activity that should be avoided because it can place too much stress on the bones and cause stress fractures. Weight loss might be indicated for osteoarthritis, not osteoporosis. Although yoga can help with flexibility, balance, and muscle strengthening, it does not directly benefit osteoporosis. Question 22. An 18-year-old male asks about using condoms to keep his girlfriend from becoming pregnant. What is the nurse's best response? A. If you use a spermicide with the condom, you'll get more protection. The failure rate for condoms is 12 to 14%. Adding a spermicide can further reduce the failure rate. Men should avoid natural skin condoms because they allow viruses to pass through. Latex condoms should be used instead. A common complaint of condom users is decreased penile sensitivity. Question 23. After their 6-month-old son is diagnosed with Hemophilia A, the parents decide to go for genetic testing and counseling. The test results show that the mother is a carrier and the father is unaffected. What is the likelihood of their having another child affected with this genetic disorder? C. 25% chance that a female child will be a carrier of Hemophilia A. Hemophilia A, also called Factor VIII, FVII, deficiency or classic hemophilia, is a genetic disorder caused by missing or defective Factor VIII, a clotting protein. Hemophilia is inherited in an X-linked recessive manner. A daughter who inherits an X chromosome that contains the gene for hemophilia is called a carrier. She can pass the gene on to her children. Hemophilia can occur in daughters but only rarely. For a female carrier, there are 4 possible outcomes for each pregnancy. 1. A girl who is not a carrier. 2. A girl who is a carrier. 3. A boy without Hemophilia A. 4. A boy with Hemophilia A. Question 24. The pediatric nurse is performing a respiratory assessment of a 2-week-old infant. Which findings should the nurse immediately report? A. Nasal flaring. Nasal flaring and NBSB is a compensatory symptom that increases upper airway diameter and reduces resistance and work of breathing. It is a sign of respiratory distress. Other signs are retractions, use of accessory muscles in the neck, rib cage, sternum or abdomen, expiratory grunting, and wheezing. Normal respiratory rate for an infant is 40 to 60 breaths per minute. Newborns often have irregular breathing patterns that concern new parents. They can breathe fast, take long pauses between breaths, and make unusual noises. Question 25. When assessing gross motor skills, for which of the following infants should the nurse request a developmental referral? B. A 9-month-old who is unable to stand while holding on. Over 90% of infants who are 9 months old can stand if they have something to hold on to. Rolling over should occur between 4 and 6 months, sitting without support is expected at 6 months. Creeping is normal at about 9 months. Question 26. At a routine prenatal visit, a client who is 12 weeks pregnant asks the nurse if she can receive any immunizations during her pregnancy. Which of the following vaccinations is safe for the client and her baby? C. Influenza. Only 2 vaccinations are recommended during pregnancy. 1. Influenza, if the client is pregnant during flu season, November through March. 2. Tetanus toxoid, reduced diphtheria toxoid, and acellular pertussis, STAP, vaccine, in weeks 27 to 36. STAP is recommended for each pregnancy. The other choices here contain live, though attenuated, viruses and pose a risk to the fetus. Question 27. At what age can the pediatric nurse accurately measure a radial pulse in a child? C. 2 years. Under the age of 2, an apical pulse is most accurate and easy to locate. A radial pulse can be difficult to palpate and count in an infant and young child. Typically, apical pulse rate is taken for a full minute to ensure accuracy. This is particularly important in infants and children due to the possible presence of sinus arrhythmia. Question 28. During a client's checkup after a spontaneous abortion at 12 weeks, she becomes angry and screams at the nurse, "Why did God punish me? I haven't done anything to deserve this." Which response is most appropriate? C. I can see that you're angry. It's so hard to lose a baby. Acknowledging the client's feelings and their causes can help the client express herself without guilt. Anger at God is a common reaction to a loss. The client is actually misdirecting her anger and can be encouraged to deal directly with her anger and grief. The other responses diminish the client's feelings. Question 29. After the delivery of a healthy infant, the nurse observes the parents with their newborn. Which of the following most indicates that successful attachment between parents and infant has started? A. The parents gently stroke and talk to their infant. Attachment, also called bonding, and NBSB, is the deep emotional bond between an infant and the people, usually parents, providing most of their care. Just as most parents feel a strong connection with their newborn after birth, babies also become attached to their parents. And NBSB, attachment begins at birth and continues to develop. Touch is essential. Infants also respond to voice, smell, and movement. When infants feel attachment, they also feel safe, secure, and protected. Question 30. The mother of a 2-year-old girl is frustrated by her daughter's temper tantrums and asks the pediatric nurse for advice. Which action is most appropriate when a tantrum occurs? C. Leave the girl alone, as long as she is safe. Toddlers are learning to become autonomous, and temper tantrums are a common way of displaying their efforts to express themselves. As long as the child is safe, leaving her alone does not reinforce the behavior. Question 31. At her 10-year-old daughter's routine physical, the mother reports that her daughter has started developing breasts and growing pubic hair. The nurse tells them that after signs of puberty appear, menstruation usually starts within. A. 30 months. Initial signs of puberty include a growth spurt, breast budding, and the development of armpit and pubic hair. Menarche typically starts approximately 30 months after the first sign. However, the range is wide. Menstruation can start from 9 to 14 years of age. In the United States, the average age for African Americans is 12 years, for Caucasians, 13 years. Question 32. A teen female client has iron deficiency anemia. The nurse instructs her to take the prescribed oral iron supplement with C. Orange juice. Of these 4 options, only orange juice contains vitamin C, ascorbic acid, which enhances iron absorption. Other foods high in vitamin C are also beneficial. Question 33. A client who is 26 weeks pregnant arrives at the emergency department in full labor. She is admitted and gives birth to a live neonate. However, the baby's condition quickly deteriorates and its death is imminent. The parents are Roman Catholics and request that their baby be baptized. What should the nurse do? C. Baptize the neonate, regardless of personal religious beliefs. The nurse should perform the baptism. The Roman Catholic Church grants permission to baptize a neonate, regardless of personal religious beliefs, in order for the infant to enter heaven. If time permits, another Roman Catholic can be found, but the essential thing is to perform the baptism before the baby dies. The parents may wish to have a priest notified for grief support. Question 34. Parents of a 5-year-old son with celiac disease are getting instruction on his diet. Which of the following grains is safe for this child? C. Corn. People with and NBSB, celiac and NBSB, disease must avoid gluten, a protein found in foods containing wheat, barley, and rye. They can safely eat corn, rice, quinoa, amaranth, pure buckwheat and NBSB, cornmeal, popcorn, millet, gluten-free oats, sorghum, and teff. Question 35. A 32-year-old primigravida who is 35 weeks pregnant is admitted following a rupture of membranes and loss of mucus plug 9 hours earlier. An internal exam shows she is dilated 4 centimeters. Because she is at risk for infection, which action is most appropriate? D. Monitor her temperature frequently. Without the protection of the membranes and mucus plug, the fetus, membranes, and uterine cavity can become infected. An elevation in temperature will indicate the start of an infection. Monitoring the patient's temperature more frequently will help the nurse assess the client for infections and the need for further intervention. Question 36. All of the following can affect pharmacokinetics in the elderly except D. Improved blood-brain barrier. All phases of pharmacokinetics are altered in the elderly. Decreases in blood flow, body fat, enzymes, and hormones can cause both reduced and enhanced drug effects. The blood-brain barrier also becomes more permeable, allowing drugs to pass more easily and in greater concentration. Question 37. A pregnant client is diagnosed with gestational diabetes at 26 weeks gestation. After the nurse provides an explanation, which statement by the client indicates that the client understands the diagnosis? D. This situation will go away after I give birth. Gestational diabetes is a condition in which a woman without diabetes develops high blood sugar levels during pregnancy. It increases the risk of preeclampsia, a large, over 9 pounds, baby, and the likelihood of a cesarean delivery. Blood glucose levels usually return to normal after birth, so lifelong insulin therapy is not indicated. Question 38. A client with stage 4 pancreatic cancer is being discharged from the hospital to her home. She tells the nurse that she doesn't want hospice care because her family will take care of her. What is the nurse's best response? D. I'm wondering how much you know about hospice. Many clients believe that hospice is only for support at the time of death. The nurse can provide information about other hospice services, equipment, supplies, and pain control, as well as home health care and support for the client and the family. The client should also know that she can enter hospice care at any time in the future. Question 39. A school nurse is instructing a health class about the dangers of smoking. Which student statement shows a lack of understanding and a need for more information? D. Chewing tobacco is safe because there's no smoke. All forms of tobacco contain carcinogens. Smokeless tobacco, snuff or chewing tobacco, has more nicotine than cigarettes. It is also a risk factor for oral cancer and precancers. Question 40. Which common condition of pregnancy can occur during the third trimester? D. Physiologic anemia. Hemoglobin and hematocrit levels decrease during pregnancy even though red blood cell, RBC, production increases by 20%. The reason is that plasma volume also increases, causing a dilution of RBCs. During pregnancy, the hemoglobin level, HGB, can naturally drop to 10.5 gmdl and still be considered normal. Question 41. During a routine checkup, the nurse assesses a 76-year-old female whose husband died 7 months ago. Which statement would indicate ineffective coping on her part? D. I've had no interest in how I look or what I wear. Why bother? Coping mechanisms are behaviors used to decrease NBSB, stress and NBSB, and NBSB, anxiety. Following a death, grief is normal. However, ineffective coping and NBSB can lead to depression and inability to care for oneself or make good decisions. The nurse should ask about the client's support system and resources. The other responses are all appropriate. Question 42. The nurse is instructing a client with newly diagnosed type 2 diabetes how to use a blood glucose monitor. Which consistent glucose level should the client report to the healthcare provider? D. 250 mg per deciliter. The client should report a consistent blood glucose level of 250 mg per deciliter so that medical management can be adjusted. 150 mg per deciliter is elevated, but does not need to be reported. Both 350 mg per deciliter and 450 mg per deciliter should be reported at once. If the client notices the levels are rising, they should report that at once also. Question 43. School-age children have different nutritional requirements from preschoolers and adolescents because of a lower. D. Growth rate. Elementary school children, ages 6 to 12, have a slower growth rate than younger and older age groups. They require the same nutrients but in smaller proportions. Question 44. As the nurse prepares a client for a transurethral resection of the prostate, TURP, the client asks the nurse about the effect of the surgery on sexual function. Which of the following responses by the nurse is correct? D. Your ejaculations will become different. Transurethral resection of the prostate, TURP, causes retrograde ejaculation, when semen enters the bladder instead of the penis. This is sometimes called a dry orgasm. It is not harmful, but can cause male infertility. Studies show there is not a change in the quality of erections, the ability to have orgasms, or the interest in sex. Question 45. After a 12-month-old receives her first measles mumps rubella, MMR, vaccination, the nurse gives the parents instructions on possible side effects of the injection. Which side effect is most important for the parents to report? D. Crying for more than 2 hours, even with consoling and comfort measures. Crying that can't be consoled is never normal. The parents should notify the office and investigate the reason for the child's distress. The other choices are expected possible side effects of an MMR vaccination.